So what are the clinical manifestations of rosacea? So it's called the curse of the Celts. So classically it does occur in fair-skinned people. However, having said that, it can occur in Asian patients, Indian patients, probably not in your really dark-skinned sort of type 5 and 6 Africans or African Americans. Classically, they flush and blush. So they may start off with transient erythema that then moves to fixed erythema, telangiectasia or broken capillaries, sebaceous hyperplasia, which are those little yellow lumps that often have dilated blood vessels on top of them, can be a differential diagnosis for BCC, but a clue would be that they're predominantly in the central face and a patient will have multiple lesions. They'll also have a waxy sort of complexion. And the unfortunate thing with rosacea is often these patients start off with having acne in their teenage years, then just when they think they're clear of all that, they develop sebaceous hyperplasia and rosacea. And probably the only thing you can say, if you're looking on the bright side, is they tend to get less wrinkles than those people who have dry skin. The next step for rosacea is often the papulopustular component, and this can be difficult to diagnose. And then on they can go to rhinophyma and other phymas such as mentophyma, nathophyma, but certainly the most common one is a nose like you saw in the painting. Ocular manifestations are often poorly recognised because patients aren't going to necessarily make the link. So you need to ask them, do they have a problem with dry eyes or gritty eyes or red eyes? And you may notice that just in the consultation. So ocular manifestations can happen in anywhere from 10 to 30%. Typically, management of the actual skin side of rosacea will actually alleviate the ocular symptoms. But if the ocular symptoms are severe, then obviously they'll need to be managed by an ophthalmologist.